To put it on? No. It's okay. You just have to put this here like this and then ask the patient to bite so that this pressure, so the bleeding will stop.
So not all they can suture?
No, for simple extraction, you don't need to.
Oh, okay.
Impact.
So for one tooth extraction, one root, easy extraction, you pull it easily, all tooth and the root is gone in one extraction. That's very easy, you don't have to suture it. Because the suturing is more complicated than just what it is. It will heal easily,
Okay.
right? But if it's complicated now, so that's just like that, easy. You let the patient bite and then let the patient bite with the gauze for how long?
30 minutes.
30 minutes to
1 hour.
30 to 45 minutes.
1 hour.
That will be discussed more in your surgery procedure, but 30 to 45 minutes, bite into the gauze, right? Just keep on biting into the gauze unless in between you're still like you can feel that blood is flowing in your throat, then you have to change, right? But you can see if like during the extraction, if you see like, oh, he's really bleeding a lot, you might have to let the patient stay for a bit,
Yeah.
right? We have to keep on changing the gauze until you feel like, okay, the bleeding stops, you can go home. Right, so you kind of assess the situation, right?
So
Now,
what is the aftercare?
yeah, I'm gonna go there. Are you gonna wanna go home now? Okay, so for example, this is two teeth extraction, right? So we're done with one. So one is easy. We're done with one. So let it bite. And now there's no more bleeding. Then we remove it. Then we start with the next one. Okay. Maybe I will see. Okay, so you put the other one here. Let's say, even if it's not next to each other, that one is easy, right? Then just leave it there too.
Max, one injection is enough for both?
So now it depends. It depends on what teeth or what tooth. In your, it's supposed to be discussed in anatomy somewhere.
No.
The nerves, the veins where you're gonna inject, the ASA, PSA.
Not yet. We did not.
No, that is part in anatomy.
No. No.
Morphology, histology, that's been discussed.
No.
You
Didn't we
did.
talk about the nerve? I swear we talked about the
I
nerve.
saw the chapter, but we didn't see it.
What chapter?
That should have been discussed.
We don't know the location, but she said it's a nerve and it's important. It's
Oh, you're in
risky.
trouble. But anyway, level two. Level two, we're gonna, because in level two we're gonna have you tested that should have been discussed in your
So who's
theory.
gonna teach level 2?
Of course, Stephanie. Who else? Anyway, so each tooth has a nerve, right? Some nerve is connected to the other nerve. So we only do one injection. Even for example, anterior, just saying anterior. For anterior teeth, all anterior teeth maxillary, always do two injection, one on the buccal side and one on the lingual side, right? Because you're not gonna numb the lingual side by just numbing the buccal side or the facial side.
So that's already
So-
for all the anteriors, Miss Rose.
For maxillary.
For maxillary.
For maxillary, all teeth, mostly, you have to have two injection sites, right? For example, just maxillary anterior. From canine to canine, if you're doing canine to canine, you're gonna inject the buccal side on each tooth. So if I'm doing 1-1, I'm gonna inject on the 1-1, on the buccal side. But on the lingual side is in the nasopalatine nerve, which is, where can you find the nasopalatine foramen? What is a foramen? It's the hole where you find the nerve, right? In here. So I only inject one here. That will numb the whole lingual of the anterior. So that, I mean, I'm just giving an example. For example, I'm gonna work on 1-4. 1-4, I'm not gonna inject on the lingual here, because if I inject on the nasopalatine nerve, it's not gonna numb the 1-4.
Premolar.
Well, that's already premolar. The nasopalatine nerve only numbs the canine to canine, lingual side of the canine to canine. Later on, we're gonna discuss that more. So, it's your job as a dental assistant to know where to put the topical. Why? Because you're the one doing topical, right? You're allowed to do the topical. If the dentist say, okay, we're gonna extract 1-4, for example, you do the topical and then I'm gonna inject later on, and then you put the topical here, and then the working tooth is here. The dentist assumes that you know where to put the topical, so he inject here, and the patient feels it's so hard because you did not put the right side of the topical. So you have to know where to put for specific tooth. You have to know which nerve you have to put the topical, because that's where the dentist will inject.